Yes, anyone who is coming in, welcome to the platform as I'm creating events. As I'm creating and setting up. As I'm setting up issues here so that you can see me well, I see what is happening. I see what is happening. It is an impromptu call. It is an impromptu call from some subscribers, and it has been a topic of interest of some subscribers that I talk on this content. This is an important content that we want to talk about, and we want to talk about some random things that we do at in our lives that are making us we slow down in some issues. Some things that we do that makes us to have secondary infertility. It will be a short session. But you see, when you are asked by several people to talk about something, it means it is something that is disturbing some people so much. So I can't sit down and just say, I'll give time to that thing that people are asking me to talk about. I have to talk about it because so many requests have come in. And when the requests are coming in, you see, you have to help, because if more than 20, 50 people are requesting you about something, it means they need information. And if you are the source of information, why don't you give them information? Now, today we want to talk about, if you see me coming live at this time, it is 10 p.m. at night. It is 10 p.m. here at in Kenya. It is 10 p.m. And this is the time when I come online and give talks to the important requests. And I've noticed that there is one request that is very important that has come through. I want to deal with it because I still have so many work to do on the issues of the heart. So our normal time cannot come and help in this. So if I am here and someone requested and will come tomorrow, I'll just give that person a link to this video. So welcome everyone who will be in the chat. This is a short session and I want everyone who is in the chat to watch and see how these things happen. The request was, people have stayed so long, family planning and why people have difficulties in conceiving, both before the first child and after having the second child. You see, family planning is a major thing in Africa and whole world. We have some types of family planning. Let me go through the types of family planning that we have and how they can be used quickly, so that I can go to the specific one, which is the hormonal types of family planning that our women use. Now, you will see that types of family planning. You see, there is barrier method, types of family planning. Types of family planning. You see, types of family planning matters when it comes to secondary infertility issues. So here you will get that the natural method is a type of family planning. We call it withdrawal. When you're having sex, you check on your calendar when you are at the safe days. And I said the safe days are 3 or 5 days. And this only happens to people that have regular periods. If you don't have regular periods, don't try. Natural methods of family planning. One, methods, no drug or device use. You count 3 or 5 days to the day when you are having your menstrual period. Then during menstrual period and 3 or 5 days when the after menstrual period, that period. You see, it is a period between this and that. So I'm giving 3 or 5 days because for most ladies, the normal periods, sometimes they come to 3 days and then they disappear. Others, they come to 5 days and then they go. The normal one is usually 5. So safe days for a woman is 15 days. For me, 5 days before getting menstruation. During menstruation, I've given an average of 5 days during menstruation, and after menstruation, you count 5 days. Menstruation, if you have sex and you are a woman, you will get pregnant. So you have to have sex 5 days before menses or 5 days. That is a simple one that I can use to tell people this is a safe day. Calendar rhythm method, avoid sex during fertile days. Yes, that is a form of family planning. You avoid sex during your fertile days. And then body temperature method, slightly after ovulation, uses track safe use and safe days. You see, cervical mucus method, billing method, fertile mucus become clear and stretch. That is in natural, and I'm naming some things that happen when you are natural. Now, withdrawal method, man withdraws before ejaculation. So your man can be tactical and know how to do it so well so that he withdraws before ejaculation, so that you cannot give the sperms in a woman to fertilize the eggs. Lactation amenorrhea method. If you are breastfeeding and you are pregnant, breastfeeding suppresses ovulation effectively for only 6 months. So below 6 months, you are at least you can suppress it. You get it? You can suppress it. Now we get and see the family other family planning. You've seen barrier method, amenorrhea, that one. When you're breastfeeding, you can't get pregnant. Now we get barrier method, and when you're breastfeeding, you can't get pregnant because breastfeeding suppresses ovulation. It suppresses ovulation. Now, these are types of family planning. Barrier method, male condom, female condom. There is a diaphragm that is put on your diaphragm method. I know some people don't know. For women, you can have a diaphragm. You can, if you have never seen a woman's condom, there is a woman's condom, but there is something called the diaphragm. There is something called the diaphragm, and this diaphragm is usually like this. This is the cervix. This is the cervix of the uterus. I want to show you, this is the cervix of the uterus. The cervix of the uterus. So the diaphragm is a cup like this, round. So this cup, this is your cervix inside your uterus. Inside your uterus, women, you know how the uterus is. This is your cervix inside your uterus. So inside your uterus, the women, if you are coming in, please don't, if you have not subscribed, subscribe, and please don't forget to leave a like so that we get more impressions and tell people that we offer some educational material here. Now, this is what is called a diaphragm. For women, when you don't want to use hormones, you take this cup and it is inserted here at your cervix. So when the sperms come, they cannot penetrate inside and go inside your uterus to go and be fertilized. So we continue. That is called the barrier method by the use of the diaphragm. Cervical cups, that one, you see, covers the cervix, the diaphragm. Spermicides. There are some women who have Evelyn Minage. Hello, Benjamin, the wise guy, and everyone. Welcome, Evelyn Minage. This is not my usual time, but I've been asked by several women to talk about family planning. So if you are watching me, please like, give me a like. Let me feel good. Don't just watch and don't give a like. I need impressions, my guys. Please, I need impression. So your like is my impression. So Evelyn, if you are a woman and you are at the age of giving out and holding babies and conception, please listen to this. It's very important to you and everyone. If you have a question, it is important. Come on, ask your question. Let me answer your question when it comes to fertility issues and infertility issues concerning what? Concerning family planning. Now, we continue and say we were on the types of family planning. I was saying there is something called spermicides. Now, spermicides, when a woman is having sex with a man, the spermicide is like a cream. They apply where? They apply around here. It's like a gel. So that the work of the spermicide is when a man is ejaculating and exposing sperms to the woman's vagina, it kills the sperm. So the sperms cannot go inside the womb of a woman because the spermicide, when you're making love, you're feeling good, you're doing all that, you apply the spermicide where? Here. You apply the spermicide here. So you feel good, you feel nice, you feel you are in heaven, ejaculation and orgasm come, and then you cannot get babies because the spermicides have killed the sperms. Very nice, very nice. Family planning methods like spermicides. If you don't know now, you know you can use a spermicide to do what? To kill the sperms. Now, hormonal methods. This is the major, and this is the topic of the day. This use hormones to prevent ovulation and fertilization. We know daily pill is called oral contraceptive. It is combined with 2, progesterone and levostrogen. Injectables like Depo, people that use Depo, these are hormones that are given to your body so that your body can suppress what is called ovulation. You know, at ovulation you can get pregnant so fast. So you give you this so that you stop ovulation in your body so that the mucus in your body can be thick and so that you cannot give birth. You know, when the mucus at your the mucus around your vagina are thick because progesterone is high, you cannot, even if the conception happens, there is no implantation. You cannot implant that egg on your cervix because now it is what? It is hard. The mucus are thick. Progesterone is there at high level, you cannot. And that's why women who are pregnant cannot get pregnant. Progesterone is high, pregnant again. Progesterone is high, you are having a baby there, no estrogen, and the mammary glands are building up so that you can get breastfeeding. So you cannot get pregnant the second time when you are pregnant. And we continue here, we say, hormone patch. There are some women who put a patch somewhere in their body that contain levostrogen and progesterone. Those who are breastfeeding, we give them progesterone only pill. Progesterone only pill because it changes them. We will talk about that. Let's go. We are just going through hormonal methods of contraception. We have hormonal IUD, the IUD that we place like the copper T, intrauterine device. The copper T that you usually use, it is copper T, and then it has some braids. It has some braids here. You see, this thing, it is put in a woman's cervix so that when the sperms are sailing, it has some coppers. The coppers, what they do, the sperm has lactic acid at this is your sperm, man. This is your sperm. This is your sperm here. This is your, I'm not putting it right. What I've drawn there is a sperm. So this sperm, when it is flowing and you have intrauterine device like copper T, you see it here at the head, it contains something called lactic acid. Lactic acid, it fuses with the wall of the ovary of a woman, and then it makes it simple for it to get that inside. But when you have copper T, this acid comes here and they interact with the copper, and the acid plus the copper kills the sperm, so it cannot get into the walls of your your cervix, so there is no implantation, so you are not pregnant. And someone will ask me, and why the threads? These threads are there to make sure that it is there. It has not gone so deep. So you keep on checking if the copper T is still there. Now, intrauterine device, we have copper T and hormonal IUD. We call it Mirena. There is one type that is called Mirena. If you are here and you are using one and you have a question, please don't fail to ask these questions. Tell your friend, come, let's listen to this. We are women and women need some advice. Now, permanent methods like tubal ligation, you can cut fallopian tubes as a woman, so that when there is conception, fallopian tubes are these tubes that I do one day, fallopian tubes that come this side and they hold them. So this is the tube. After fertilization here, it flows. After fertilization, are we having time? Yes, I'm going so fast so that we can meet the deadline. So after fertilization on your follicles, the baby now, because life starts at conception, it flows up to the fallopian tubes. So when you cut the fallopian tube, there is no sperm that will go up to this end to get, and then they relax, they make love again, and then they fuse, and the conception happens. That is cutting fallopian tubes and tying them. We call tubal ligation. Now we have another one which is called vasectomy. A man, you cut your vasectomy. You cut your what? You cut your I wish I had water, but it's okay. You cut your sperm ducts. When your sperms are released, they cannot cross to the other side. And today's emergency contraceptions are like P2. Please don't take P2 so much. They give us hell of track in the hospitals by ectopic pregnancies. I'll talk about that. It is emergency. Use it when emergency. Don't have emergencies every time. Don't have emergencies every time. Let's continue about talking about these issues. We have modern vas tradition, pills, condom, intrauterine device, and injectables, and also implants are modern methods. But we have another traditional method, that is withdrawal, calendar methods. Those are traditional methods. Let's go to the topic of the day where we are talking about definitions. Primary infertility and secondary infertility. Now, primary infertility, failure to get pregnant after 12 months of regular unprotected sex. You are having regular sex at 12 months. You get it? Of regular unprotected sex, and you don't have a baby. That is called primary infertility. Secondary infertility is difficulty conceiving after the already having a baby, and that is where we are. You have difficulty in getting a baby after you already have a baby. One, we are minding our business where you are using family planning. So what happens when you are using family planning from the first baby and you are with your man, and now you have decided, now we want to have a baby, and let's talk about babies. I think we need another one, and you are not getting it. This is how it happens. This is how it happens. Hormonal and ovulation problems. Irregular ovulations. When you are taking hormonal methods of family planning, especially the depot for 3 months and daily pills, conditions like polycystic ovarian syndromes cause irregular periods and no egg release. Some family planning are linked to polycystic ovarian syndromes. Fluid that is thick accumulating somewhere in the ovary, and it is making the ovary feel that there is something. So, you know, if the ovary feels that there is something that is growing in your body, it changes the hormones. So you start having problems. Hormonal imbalances. Problem with estrogen, progesterone, luteinizing hormone, and follicle stimulating hormone. Disrupt ovulation. So ovulation is normally what ovulation is. When the egg is being released and you are feeling now you are hot, you need someone to be there so that you can be, the egg should be fertilized. That is the area where someone needs his person, her person so much. So this family planning of hormonal methods, what they do, they change your hormonal system method, and then what you do, you start having what? Hormonal imbalance. You start having hormonal imbalance. And then there is something called family thyroid disorders. People that have thyroid problems, they have a problem that is, let me see, they have something that is just a minute. Let me make a continue. Let's continue, my guys. Let's continue, my guys. Let's continue, my guys. Let's continue, my guys. Sorry for that disruption. It has been a disruption of it has taken my seconds. My seconds. Now, you are we are at hormonal methods. No, infertility and methods that are here blocking our. Now, that is for women factors, tubal uterine blockages, and doing what? This is Evelyn, listening keenly. Thanks, Evelyn. If you have a friend who thinks he's struggling with this, Evelyn, please share this video to her. Tubal factors, blocked fallopian tubes, often due to infections like pelvic inflammatory disease, uterine fibroid, endometriosis, and uterine abnormalities. And then there is something we have here that is very important. I'm going randomly, so the next 30 minutes I'll talk about family planning alone. You get it? Lifestyle and environmental factors. Smoking and alcohol. I will not even talk about smoking and alcohol again. Smoking and alcohol is a problem. Smoking and alcohol is a problem. And you yourself, you have seen how smoking and alcohol is a problem. Every place we are going and talking about just a minute, Kilia. Okay. Oh, had placed that on the wrong side. Just give me a second, tafadhali. Just give me a second. I'm posting something important here. Now, lifestyle. You are taking so much of junk food, taking so much of carbohydrates, and a minute, yes, I've got it. A minute, I've got it. Junk food and everything. And then you start having problems with ovulation because you are obese. Please take care of that. Please take care of that. Obesity or underweight. Stress. You have stress, and follicle stimulating hormone and luteinizing hormone and progesterone, they have an imbalance. Exposure to toxins like chemicals, radiation, pesticide. And then there is age. Advanced age, we talked about it. Delayed childbearing, infections, sexual transmitted disease, chronic diseases like diabetes, hypertension, or autoimmune diseases affect fertility. They affect fertility. You get it? It is important to check on these things that are still on. Yes, it is important to check on these things that are very important that we should be not doing when we want children. Family planning methods and their effects. Now, that is where we are. Methods like pills, implants, injectables like Depo for 3 months usually do not cause permanent infertility, but Depo injection may delay return of infertility from 6 to 12 months. This one is not secondary infertility. You get it? It is not secondary infertility, but it delays. It delays. Yeah? Now, let's see. If you have a question, anyone who is watching, leave the question in the chat. If you have, please ask. If you have a question concerning family planning and its effect, it's important you please ask the question. We are here up to 11. It is 1 hour. It is 1 hour. So it is important we check out what is important and what is not important. So we need to know why Depo, the hormonal methods. If you've been having Depo and the family planning pills, and Depo is progesterone and levostrogen that you inject in your body. So if you've been using it, you know how to regulate. Now we have a pathophysiology. Hormones delay means disruption of the normal reproduction hormonal axis, leading to they delay by disrupting the normal cycle of a woman. The normal cycle of a woman. This is a call from a person. I talk about it, but we will talk about the normal cycles and how the cycles come when we will come to gynecology. Now, delays ovulation, you get irregular cycles, you get failure of fertilization or implantation. You see, the hypothalamus in your brain, pituitary and ovarian axis, we call it HPO, is disrupted. The normal pathway, as we understanding, listen to this, it's very important. The normal pathway of a woman menses so that you can get China Mary Simba. Welcome. It is 10 here at 10:30. This is a call from our subscribers, me to talk about hormonal methods of family planning and delay in childbearing. We had our normal talk at 16:30, and people really embraced it. So if you are here, like, share, and if someone has the problem he has been using or they have been using, I usually say they have, because having children is an affair of both of you. So if they have been using family planning, listen, the normal, how the hormones go in your body as a woman is this. Hypothalamus releases something called, in the brain, there is a place we have hypothalamus, the thalamus and the hypothalamus in the brain. So it releases gonadotropin releasing hormone. We call it pulsatile. gonadotropic releasing hormone. This one is not a big word. Gonads means your vagina and my penis. That's why it is called gonadotropic releasing hormone. It excites the release of gonads hormones, the vagina and the penis hormone. So in a woman, it is the vagina hormones. So pituitary gland releases, so hypothalamus releases the gonadotropic releasing hormone, and pituitary releases follicle stimulating hormone, which stimulates the follicles of a woman. Where is my paper? Where it stimulates the follicles of a woman. It's important to get to know these things in detail so that you don't get confused. Just a minute, I get a paper. I want to draw your uterus and your follicles. These papers, come. I'm struggling to push you out. Yes, I've got you. Now, look at, I want to draw yes, nice. I want to draw a uterus. A uterus this is the fundus. This is the fundus. This is the fundus, and this is the uterus. I'm drawing a uterus of a woman. I want to explain something very important. So if you are a woman, just wait and see how your uterus is. It is a flower. You know, love sign is like this. The uterus takes a sign of love flower. It makes women the most important creatures in the world because love is for good feeling. Now look at this. This is look at this. Look, it looks like a what? It looks like a flower. Now these are the follicles. So you are this is called the fundus. The fundus here. So gonadotropin releasing hormone from a woman's brain at the, we have said it is released at the pituitary. Hypothalamus releases the hypothalamus. In your brain, there is a place called the hypothalamus. So it releases gonadotropic releasing hormone. Gonadotropic releasing hormone directly means the hormones of the private parts, the vagina and the penis. So it releases that hormone to excite. And when it releases it, it stimulates something called the pituitary gland in your brain. And the pituitary gland stimulates this called the follicles. Stimulates the follicles. So the follicles grow. And then it does not, the pituitary gland does not release only the follicle stimulating hormone. It releases follicle stimulating hormone. You see how it is called? It stimulates the follicles and luteinizing hormone. So the work of the follicle is to stimulate these follicles to grow, to release more eggs. And then luteinizing hormone triggers ovulation. So you see how they come? Follicle stimulating hormone, luteinizing hormone. So one triggers what? One triggers the growth. Remember, we have started from the brain, whereby the brain is triggering. This is the normal way. The hypothalamus, the thalamus that is down, releases gonadotropic releasing hormone. Then the pituitary gland is excited. It releases follicle stimulating hormone to help these follicles to grow, to be good, to get you to get good eggs. It makes you to get good eggs so that you can bring out good children. Elmarie Smith, hi doctor, greetings Elmarie. I'm talking about getting babies and how people delay in getting babies using family planning method. So this is the normal ovulation. So when it has produced this, luteinizing hormone does what? It makes your luteal phase to come out so that you can get ovulation. Those are the very important hormones. It leads to endometrial preparation. So this thing, it means to your endometrium to prepare to get a baby, and ovulation to prepare these follicles to be nice and ovulation to come to release the egg so that they can meet at the road. You see, when you are going to meet your girlfriend for the first day, you meet somewhere at a restaurant, you don't meet home. So they meet at home, and this is where at the road, and they go, they fertilize so that they can come and live at their home till 9 months are done at the uterus. So, and something called implantation is done at the, now when the sperms are walking, they come to they fertilize here in the fallopian tubes or in the follicles. So after fertilization have occurred, they come back, as they hold their hand, they say that we love each other. Now we're going to produce a beautiful baby. Now we're going to live together as S chromosomes and M chromosomes, and they implant themselves at the endometrium, and then it starts to grow here. Now your baby starts to grow here. So after that process, we continue ovulation, preparation. If fertilization is occurred, it gets to implantation. When it gets to implantation, what happens? You have a baby. Boom. You have, as Roger Skillier says, boom. You have a baby. You have life. Life starts from conception. Life starts from conception. Now, that is the normal way of how things are happening. Now, how does, you've seen, it is 10:38. Let me say again, you've seen that way. We are starting from the head of a woman, where hypothalamus, that's what hypothalamus produces gonadotropin releasing hormone. So it is the one which releases the hormones, luteinizing hormone and follicle stimulating hormone. So follicle stimulating hormone makes the follicles healthy to produce good, healthy eggs. A beautiful, I call them a beautiful egg, a beautiful baby woman, a girl, to meet a boy, which is the sperm, which is so healthy, and they are coming to meet at the road, which is the fallopian tube, to hug and say we like each other, we're gonna stay together forever. And when they come each other, for luteinizing hormone is making sure that the hormone, the preparation, the luteal phase, the temperature that is needed is there. Those are the gonadotropin hormone prepared from the pituitary gland. And they started by excitement from the follicle stimulating hormone. So when they prepare and say, yes, let's move, let's meet and say we want to live together, they come, the implantation is made at the normal methods. That is the normal method. And when we'll be talking about ovulation, and so we will see how people, the numbers and how you get irregular. Today, I'm talking about family planning and delays in family planning. Now, we get to pathophysiology of hormonal delay. Hypothalamic dysfunction. So when your part of the brain is called hypothalamus, the hypothalamus, you are using a hormonal method and you are having stress. Maybe things are not going well with your husband, or some internal affairs or social affairs. Stress, you lose weight, because chronic illnesses also. Stress makes some hormones like dopa not to come out, serotonin not to come out. Yeah. So when serotonin is not coming out, what happens, my dear friends? The hypothalamus is having a dysfunction. Weight loss. Most of the hormones are produced from your fats. They are called steroids, catecholamines. So when you have weight loss, you don't have some fertilizer, let me say that in a simple way, to make those hormones come out. Chronic illnesses may change the hormone production. So mechanism, gonadotropin releasing hormone secretion is reduced follicle stimulating hormone is reduced. So when you don't have something that is giving your follicles health to produce good health, and there is nothing like luteinizing hormone for preparation of implantation, will you get pregnant? You will not. No follicle development. It is called anovulation. If there is no follicle stimulating hormone that is coming, pumping, and giving site to, you get it, you will not get pregnant because there is no follicle stimulation. It's not producing eggs. Where will the sperm get its girlfriend for conception to happen? Sperms will be coming and going. Seen in functional hypothalamic amenorrhea. Functional hypothalamic amenorrhea. They seem so great words, big words. Yeah? When I'm talking, I don't want you to feel these words are big words. They are not big words. Like when I'm dropping releasing hormone. Now you know it means what? Yes, you have said. Functional hypothalamic amenorrhea is a condition where menstruation stops because the brain reduces hormone signals that controls ovaries. Functional. The brain at the hypothalamus has stopped. So gonadotropin releasing hormone is not being signaled as it is. You get it? And this one happens most of the time at 45 and going to 40 when menopause is coming. Functional. Pituitary disorders. I've said pituitary produces luteinizing hormone and follicle stimulating hormone. So mechanism. Hyperprolactinemia. Prolactin is a hormone. So let's see what is hyperprolactinemia. Prolactinemia. What is hyperprolactinemia? It's a condition whereby it's abnormal high prolactin hormone in blood. Hormone produced by the pituitary gland stimulates breast production, normally controlled by dopamine, which inhibits it. Dopamine is a happy hormone. If a mother is breastfeeding, dopamine does not come out because it's telling you, hey, this mother is breastfeeding. Don't give us the happy hormone. Don't give us. Don't go. The prolactin is stimulates it and says, don't let the baby breastfeed in peace. So prolactin stimulates something called breast production from mammary glands. And when it is producing, it is giving that. We have 25 minutes. If you have a question, you can post it. If you have a question, you can post it. Now, when it is giving you that you are breastfeeding, prolactin comes in from the same pituitary gland that gives us follicle stimulating hormone and luteinizing hormone. And it inhibits production of gonadotropin releasing hormone because it is telling this mother, this is time for breastfeeding. It's not time for making love. That's why DOPA goes down from the brain because DOPA helps to stimulate good feelings to make love and to do those such things. And gonadotropin hormone will be suppressed, stopped from the same. If it is producing prolactin, gonadotropin releasing hormones goes down. So prolactin, as it inhibits gonadotropin releasing hormone, it means there will be no luteinizing hormone and follicle stimulating hormone. So you don't have ovulation. The result is amenorrhea and infertility. Amenorrhea is you understand amenorrhea. I know women understand amenorrhea. If you are listening to me, who is understanding what amenorrhea is? Who is understanding what amenorrhea is? Amenorrhea. Lack of, come on, say it, one. Say it. Menses. Lack of menses. Sometimes when you are breastfeeding, it is normal not to get menses. You get it? Sometimes. So that's what happens when you get breastfeeding. You get it? And then you're taking that thing called progesterone only pill. And then ovarian dysfunction. Sometimes ovaries can have a dysfunction and have polycystic ovarian syndrome. Some of people, they get polycystic ovarian syndrome when they are having family planning. So it increases luteinizing hormone to follicle stimulating hormone ratio. Excess androgen, testosterone, follicle starts to grow but fail to mature. Follicles, they grow but they fail to mature. You see, that one we'll talk about. That one is under the topic called complications of the ovary and the uterus in women. Thyroid imbalance, we have talked about it. Luteinizing phase defect, inadequate progesterone production, poor corpus luteum function. We will talk when we are dealing with normal. Hormonal delay. Let's talk about the family planning, hormones. Hormonal delay after family planning is important. Depo-Provera, 3 months injection. This is how it works, and that is what I know people are really wants to know how it works. Depo-Provera injections. Continuous progesterone suppresses the one I've said, gonadotropin releasing hormone, and then it reduces luteinizing hormone, luteinizing hormone. Endometrium remains thin because it is supposed to be thick, the walls of your uterus, these walls, so that you can get an implantation, these walls, so that you can get an implantation. But when it is thin, there is no implantation. Then we get something called feedback loop disturbance. Estrogen and progesterone regulated by hypothalamus. There is something called negative feedback. The feedback becomes abnormal. Hormonal levels become uncoordinated, leads to irregular cycles, delayed ovulations, and fertility, infertility, and fertility disorder. And then we have cellular molecular level, at the cell level. Gonadotropin releasing hormone pulse frequently determine fast pulse, luteinizing hormone. Slow pulse is follicle stimulating hormone. It gets disturbed. So you may ask, we are talking too much. This is a short why delay? Why I've stopped using the hormonal method? Why delay? I've stopped using. Why delay? Doctor, when I use family planning, I usually receive monthly periods each and every day. What could be the problem? What could be the problem is hormonal disturbance. We go back to where we have seen the disruption of the disruption. Let me go back to go through the video. There is somewhere I've said when there is no release of follicle stimulation hormone, it will not release luteinizing hormone, and it will not release what? It will not release follicle stimulating hormone. Follicle stimulating hormone, Evelyn, listen to me politely. It helps in making sure that the follicles are good and they are healthy so that they can produce egg, Evelyn. And then the luteinizing hormone takes care of the environment, temperature, takes care of the needed hormones like progesterone, and it makes this layer thick so that you can implant. And you know, when there is implantation, you cannot get what? You cannot get pregnant because progesterone is high and there is suppression of gonadotropin hormone. So why you get menses each and every time? Sometimes people have weak hormones like estrogen. So your layers become thin and you start bleeding. Bleeding. When they are thick, bleeding cannot be there. You start bleeding because now there is normal hormonal disruption. The luteinizing hormone and follicle stimulating hormone, they are suppressed. They are not coming out because the family planning now, what it has done is it has stopped the gonadotrophic hormone to stimulate the normal flow. Please rewatch and rewatch carefully. You will learn a lot on that. Have I answered that question? When luteinizing hormone and follicle stimulating hormone are released, your uterus is thick. Now bleeding becomes rare. But when you're using family planning and it has stopped gonadotrophic releasing hormone, so luteinizing hormone and follicle stimulating hormone are not there, it becomes thin. So the effect is some people start bleeding and menstruating each week, and getting children becomes a problem. So you should that and take a combined oral pill sometimes when you are using not combined. Now we continue, and we have talked about amenorrhea. We have talked about amenorrhea, and my last question, as I have the 10 minutes, if you have a question, please ask. My last thing that I want to talk about is why delay is long with some methods, injectable, especially like DEPO. When you are given DEPO, it is a progesterone pill. So contains long-acting progesterone. Drugs stay in your body for months. Drugs stay in your body for months, and you cannot remove them. We don't have an antidote for hormones. You just have to wait for like 6 months or so, or 1 year. Mechanism: continuous progesterone suppresses luteinizing surge, prevents ovulation. Once, for those people who have used this progesterone for 3 months, the DEPO for 3 months, more than 3 months, you have used them for more than 3 cycles, like 3 months, 3 months, 3 months, like a year plus. It does not come out of your body faster. It takes long because this is called long acting. It is called long acting what? DEPOs. Progesterone. It stops your luteinizing hormone to prepare for ovulation. Even after stopping, hormonal levels decline slowly, because when you stop, those DEPO will not just come out of your body. You've been using them for a year, so they slowly come out, slowly come out. You get it? Evelyn, I hope you have understood. There is something called implants. Hormone release slowly over time. After removal, hormones fall faster than injection. Fertility returns in weeks to months. So I would advise women to be using implants rather than DEPO, because implants, they release the progesterone slowly. Pills, the daily pills, short acting. Fertility usually returns very good, 1 to 3 months, because you are taking them slowly by slowly. But there are other women who have endometrial effects. You get? Hormonal methods also affect the uterus. Endometriums become thin and inductive at times. After stopping, it needs time to regrow and become receptive. When you are using this, just as I've told Evelyn Minake, luteinizing hormone makes your uterus to be thin, not to get in the low luteinizing hormone makes your uterus to be thick. But when luteinizing hormone is there, it becomes thick and gets good environment for ovulation. You get it? It gives good environment for ovulation. So when you continuously use luteinizing hormone, DEPOs, and so they make your uterus thin, and it needs time to regrow and go better to go to a normal level. So the other thing we have talked is pills. Endometrial effect, that one we have said it becomes thin, and it needs time to regrow so that you can get an implantation. ovarian sleep effect. Ovaries have been inactive. Follicle stimulating hormone is not there to excite the ovaries, like it's like fertilizer, to tell them, please, come on, grow, release eggs, release ovaries, release some ovaries, the eggs. You see why you delay when you are using hormonal methods. It is important to note these are the factors that make you delay when you are using family planning methods. Whether you've been using it from the first time before getting a kid, or whether you've been using it after you've got a kid, those are the effects. Now, you check on ovaries have become inactive, there is no follicle stimulating hormone, and you are at 21, 22. You start using family planning methods, injection hormonals at 21, 22, and you want to get a baby at how old? You want to get a baby at 30 years because you want to explore. You have been using emergency, now you are using daily. You have made your uterus so thin, so when you want to have a baby, because now the hormones have made the uterus to be thin, there is no luteinizing hormone because gonadotropin releasing hormone has stopped working. You need time for therapy to those hormones to release. You know, from 20 to 30, those are 20 years. Some people start using hormones even when they are young as 19. The world. Some parents, you take your children to get you Susan Mwenda official, Susie, now I'm talking to you. You go to tell your children, because you are in university, I will give you hormonal method. Susan, please rewatch the video and share this video to someone who asked you this question. You take a child to university, and because you don't want grandchildren earlier, you gave them implants. Now you know the release of gonadotropin hormone is suppressed. There is no follicle stimulating hormone. There is no luteinizing hormone, and your follicles are not healthy, and your uterus is thin because there is no luteinizing hormone. The gonadotropin releasing hormone has stopped. You get? Has stopped. So what do we tell our parents? Don't tell our children that you can continue having sex in university and you are still young. Sit with your daughters down, tell them you are still young. This thing will have an effect when I need grandchildren. Abstain. Or if you can't abstain, once in a while use a condom. Yes? Use that condom. Stop messing up with your hormones. Now, a lady who is 28, not let's go to 28, let's go to a lady who is 25. You don't want to get babies because finances and economic stability is a problem. When you mess up things, you take emergency pills. You can get something called ectopic pregnancy. We'll talk about ectopic pregnancy. And as you do that, because emergency pills are hormones that are very constricted, what do? You suppress gonadotropin releasing hormone with your hormonal taking cycles. You make your ovaries and follicles to sleep. So at 30, 35, when you want to start to get babies, the uterus, you stop. First, you have to wait the hormones to clear. You have to wait your hypothalamus to think now the body needs the gonadotropin hormone, and you have to wait for luteinizing hormone and follicle stimulating hormone to start to be produced so that your follicles can produce nice eggs, so that your hormones can produce the thick layer that can enable implantation, and that takes a month. No, it doesn't take a month. It takes 1 year to more than 2 years if you have been using them since an early age. You see, masking and now I've talked that. You will talk to our young girls. We'll talk to them. And now a person who has been using hormonal methods of family planning, you kindly know why you are delaying to get kids, and you kindly know why you have not got any kids. Today I'm not laughing. No, I don't want to laugh. I love kids. So Susan, when you want to get kids, I know you are a young lady. Get your boyfriend. Tell your boyfriends, let's use the good method so that when you want to get kids, our uncle Dr. Benjamin will be happy to see our healthy kids laughing, walking, and walking around as our family is growing good. We don't want to give birth again to children that have problems. Why? Because when you are waiting for good implantation, the family planning has taken so long and it has suppressed some hormones, you may get problems like polycystic ovarian syndromes, and children may grow up with complications. You see that? Don't laugh at our parents. They were getting many children. They were getting many children that are healthy. Our parents were getting many children that were healthy because this kind of family planning that we are having nowadays, they didn't have them. But look now, look complications that women are bringing to their children at an early age. Now, let's continue. I don't want to preach that way. We continue to hormonal imbalances. After stopping, hormonal may fluctuate irregular, unstable estrogen and progesterone. It leads to irregular periods. So, as I finish, if you have a question and you've been watching, please post it. And I want you, we love our ladies so much. If you are a lady here or a man and you are watching this video, share this video to our young ladies. Don't preach to them for those that are so adamant. Just share this video to them. Let them visit it. Let them watch calmly by themselves. We want to revise sanity and bring back sanity to the society, especially those people that give their children in universities who are young, family planning. I want to enlighten them. So, summary, I will say, if you have a question, please drop it down. I have 10 minutes before I log off. This was an impromptu call, and I thank everyone that is watching right now. I thank everyone that has come to watch, because it will help your daughter, it will help your niece, it will help your family that is there, it will help someone that needs this image, this talk. HPO axis suppresses hypothalamus pituitary ophthalmic, hypothalamus pituitary and, wait a minute, kidogo means kidogo means wait, kidogo, wait a small, kidogo, wait small. So the summary that I have for us people here, the summary is the factors that delay because of you using hormones is 1, hypothalamus in the brain, pituitary in the brain, and ovary suppression, no ovulation. Slow drug clearance. The hormones that you've been taking and injecting yourself, mostly the injections, they take long to clear from your body. Long delay. Thin endometrium, because you have been suppressing luteinizing hormone through suppressing gonadotropic hormone. So there is no luteinizing hormone to take care of your endometrium. Endometrium is this. Endometrium is this. It has to be thick for implantation. And you know that is the work of luteinizing hormone. Follicle stimulating hormone is for the follicles to make sure the eggs are good and good environment and temperatures here. So you've been taking those, injecting yourself with family planning, and then the endometrium becomes thin. Using hormones, you bleed every day. You can't implant. Even if the house, if you are living in a small house of 30 by 100, small house, you cannot live many people. Ovarian inactivity. You have been using the hormone so long, and the ovary is not being excited by follicle stimulating hormone. What will you get? What you will get is the ovary will be in sleep mode. And before it wakes up to start producing good eggs, it starts very slow to adapt. So slow means 8 months to 1 year to 3 years. We never know when it will be active. Every person has got genetic makeup, and you present as per how you are. Hidden conditions like infertility can help, but when you have a child, just know it is the family planning that you've been using. That is my end today. That is my end today. This was a topic that was requested by one of us who is called Susan Mwendwa. So see, now you know how you can help your friend plus the others who requested. I thank you everyone that has tuned in, that have listened. Please, I have one request. I have one request. Please share this video to young ladies that are in university. Please share this to young ladies that are in the university and their boyfriends. I thank you all for pulling up at late and coming to watch this. It is important. For those who will watch, please share this information to parents and young ladies that are in the university. Bye. See you another day tomorrow as we continue our topic on what? As we continue our topic on cardiac issues. This was just an impromptu. I love you all. El Marie Smith. I love you, Susan Mwendwa, Evelyn Minage, those that have commented, Mary Chirisimba, China Mary Simba. Thank you for tuning in. Please share widely. This is a very strong information for our coming generation. It will help a person, it will help a family, it will help a mother to avoid getting more even diseases. May you be blessed wherever you are. Sleep tight. Good day. Good morning. Bye. Bye-bye.